Swimmers have a lot of shoulder injuries and pain throughout their swimming career, likely due to the overuse of doing millions of strokes. Likely, this is going to put stress on the rotator cuff muscles and tendons, causing an issue called swimmer's shoulder, also known as shoulder impingement. But there are other joints that can be injured and involved. The acromioclavicular joint, or the AC joint, is right where the clavicle or the collarbone attaches to the shoulder. This bone or this area can be very loose in swimmers, causing a piano key or excessive motion, or from direct trauma if someone falls, they can have AC joint separation, which is listed as grade 1 through 3, with 3 being the most severe. A muscle underneath the clavicle or collarbone known as the subclavius is often tight when someone has excessive motion at this joint, as this muscle is overworked to try and stabilize it. So doing some self-myofascial release or self-soft tissue work can help relax that muscle and allow it to stabilize and have a little bit more force to protect the shoulder from all the excessive motion that comes with extra motion or excessive motion at the AC joint. So what you can do is just add some lotion or not, whatever, depending on how dry your skin gets, and you're just going to go right to the collarbone, take your thumb, press up and back nice and slowly as your other arm is relaxed, or the arm you're working on is relaxed. Really trying to go nice and slow, finding those trigger points. So if you find anywhere that's tender, you just lay right on it, hold, and move nice and slowly underneath the collarbone. Once again, I'm kind of pushing up and back here as I'm moving and traveling all the way along the collarbone. Do this for about 2 to 3 minutes, especially if you have AC issues, or if you just have generally sore shoulders or even shoulder impingement. This may be a muscle you haven't worked on that could yield improvement. Once again, this is just a self-myofascial release of the subclavius muscle.